Most people think heart disease begins with a heart attack. In reality, a heart attack is often the result of changes that have been developing inside the body for years. The challenge is that these changes rarely produce dramatic symptoms in the beginning. Instead, they appear as small signals that are easily ready to be dismissed, like stress, aging, lack of sleep, or maybe busy lifestyle. Today, I want to talk about 5 warning signs. Those 5 warning signs that may indicate your heart is under more pressure than you realize. The first is high blood pressure. What makes high blood pressure dangerous is that most people feel completely normal. There is usually no pain or discomfort, yet elevated blood pressure continuously places strain on the heart and the blood vessels. Over time, this increases the risk of heart disease, stroke, as well as kidney problems. That's why regular monitoring is important even when you feel absolutely healthy. The second signal is a noticeable drop in your energy levels. Everyone feels tired occasionally, but if climbing stairs feels harder than before, or you are getting exhausted by activities that never used to bother you, it's worth paying attention. Sometimes fatigue is one of the earliest signs that the cardiovascular system is not working as efficiently as it should. So the third signal is rising blood sugar. Many people think diabetes and heart disease are separate conditions, but they are closely connected. Elevated blood sugar damages blood vessels and increases inflammation, which can significantly raise cardiovascular risk. This is why pre-diabetic should never be ignored. The process often begins years before the diagnosis is made. Now coming down to the fourth signal, which is poor sleep and chronic stress. Many professionals today sleep less than they should, many a times working for long hours and remain mentally switched on through the whole day. Over time, poor sleep and chronic stress that can increase your blood pressure, worsen the blood sugar control, and negatively affect your heart. While stress cannot always be avoided, it can be managed, and that makes a real difference. The fifth signal is an expanding waistline. This isn't about appearance, it's about metabolic health. Excess fat around the abdomen is strongly associated with insulin resistance, inflammation, diabetes, and cardiovascular disease. In many cases, a growing waistline reflects changes happening inside the body long before the symptoms have appeared. At Madhavbagh, we have seen many patients who felt completely healthy until routine evaluations revealed early risk factors such as high blood pressure, borderline blood sugar, as well as poor metabolic health or increasing abdominal fat. These changes often seem small on their own, but together they can tell an important story about future heart health. Now, the good news is that most of these risk factors can be completely improved. Regular movement, better sleep, healthy nutrition, stress management, and routine health checkups can significantly reduce down the future cardiovascular risk. The important thing to remember is heart disease rarely develops overnight. In most cases, the body gives signals long before a major event occurs. The question is whether we are paying attention or not. Because when it comes to heart health, early awareness is always better than late treatment. The question is whether we are paying attention to it or not. Because when it comes to heart health, early awareness is always better than late